about the effects of therapy. And I told you the best done single study. There are a number of not very well done studies that compare people that received treatment versus people that did not receive treatment. Some of these were reviewed by Eysenck. And Eysenck got himself criticized by presenting non-experimental results. He was very much interested in the question, do the people who get therapy, are they better off than the people that don't get therapy? And he looked at a fairly large study of what was called war neurosis. The word neurosis, as we're going to see today, in World War I, it was called shell shock. Back in World War I, people who used to live in the trenches, the other side would fire artillery at them. They would go into bunkers underground, and these shells would go off. And if a shell hit your bunker or went into the trench where you were, well, you'd be blown up, and people would get, sometimes some people would just stop functioning. They just didn't want to come up out of the trench and run through the machine gun fire and poison gas to the other side. So it's called shell shock. World War II, it was called war neurosis, or the Americans liked the term, that was the English term was war neurosis, the American term was combat fatigue. So sometimes you may know the famous story of General Patton slapping the soldier. He's looking at a hospital, he's looking at soldiers that are wounded, and he comes across one, he didn't see any wound. He says, "What's your wound, sir?" And he said, "Combat fatigue." You know, and Patton says, "You don't have a wound." Whack! Slapped him. Get back out. Get back on the front. You should be with your group. And then Eisenhower was mad about that because he then went and slapped another person, did the same thing, and then they withdrew him from command. So he was punished for a while. Then they put him back in command again later in the war. So combat fatigue was another one. Today the term we will use is post-traumatic stress disorder. So you're going to see lots of movies and TV programs about people returning from Afghanistan and the Iraq War, and maybe hear stories about Vietnam veterans that are having post-traumatic nightmares that they're suffering through and so on. And war neurosis in World War II in the British military was defined as either they had an early breakdown meant that they ceased being able to do their job before they actually were in combat. Maybe 1 out of 6 members of the armed forces in the war actually were combat soldiers. The rest of them were cooks and supply people and doing all sorts of other jobs. But 1 in 6 were in combat versus combat. And they either got treatment or they got no treatment. And the criterion was what percent went back to their unit within 1 year. So it was 57%, 55%. So those that broke down and ceased to be able to do their job, so they had to be taken out of their unit. It's a little bit less likely to return within a year if it happened in combat. Those who did not get treatment, now is a big number better or worse? This is the percent who returned to their unit. In other words, they're able to go back to the job within a year. So big numbers are good. So this is the evidence of improvement. 65% and 62%. So Eysenck argued based on this that the people that received the treatment aren't any better off than people that didn't receive the treatment, and in fact they're a little bit worse off. And people responded as they should have to non-experiment by saying that, well, wait a minute, maybe the ones who got the treatment were worse off to begin with than the ones who didn't get the treatment, and so they had a scarce resource, namely psychiatrists working in the military. And so the fact that the no treatment looks worse is because they did not have random assignment to conditions. So these aren't randomly assigned to conditions. This is not an experiment. This is basically, we can call it a survey. This is simply looking at military records. Eysenck wrote a number of reviews of the effects of psychotherapy. One of the reactions, his reviews concluded that he didn't see much evidence for benefit, and in fact he found evidence for harmful effects of the therapies being done at the time. People reacted in two ways, with irrational arguments, I'll call them. And the argument goes like this: it's blasphemy for you to complain about the benefits of psychotherapy because we are giving therapy and we want to help people, and therefore the idea that we might be harming people is blasphemy. You've got to be a believer in what we're doing or it will really upset us, and Eysenck was definitely upsetting. Another sort of heretic name, you should know the name Eysenck because he became famous for these articles and arguments, and so his arguments were discussed, was Thomas Sauce. You're going to see his name come up and mentioned by Zimbardo, and you've read about it in the chapter. He's a psychiatrist. And his argument is that we're not even sure we know what mental illness is. Maybe these are just names that we're creating in order to describe people we dislike. So is there really something called mental illness? So he argued, and you're going to see that position discussed in the Zimbardo tape, and you've read about it. Okay, well let's see, what do we mean by, we're using this term illness, and this refers to the medical model, so we need to understand something about the medical model of disease, and I've already given you a couple of ideas. We want to know, how do you categorize? What diseases are there? What dysfunctions, what disabilities, what are the problems that can occur? What causes them? Because if you knew what caused them, you'd know how to prevent them. How can you cure them? Okay. So let's look a little bit at the history of medicine to understand what is the medical model of illness and contrast that with what we are going to call mental illness. And the modern, old-fashioned medicine was based on the theory that disease was caused by imbalance of humors. They didn't really know what caused the imbalances of humors, but they had certain ideas. What were the cures? What were the humors? Well, there's blood, there's black bile, there's yellow bile, and phlegm. And what do? Well, we try to rebalance the humors. Person might get what's called scarlet fever. How do we know they have scarlet fever? Because they look kind of red. Their throat might be red. They have a fever. They're hot. They get a rash on the skin. So we have a collection of symptoms. Why is it called scarlet fever? Because the person has a fever and they're red. This must be excess of blood. So what do? You let out blood. In order to rebalance the humors. So too much blood, let out some of the blood, that's what you do. Also you can have purges of various kinds. So poisons that people take that cause you to get rid of the black bile, or make you urinate and get rid of some of the yellow bile, or to try to draw the phlegm. Maybe they have candles that they would light and then stick a glass on your back to try to draw sweat up out of your body, to try to remove the phlegm somehow from your body. So they had various purges. Basically today we call them poisons that make people vomit and do things like that. And this was how medicine used to work. But this is old-fashioned. And it was swept away. They don't do this much anymore. I mean, the doctor will come and draw some blood out of you, but that's for other reasons. They're trying to do tests or looking for things in your body with the blood. What's the new medicine? Well, let me tell you a little bit about the history of the new medicine so we can understand where psychology is relative to old-fashioned medicines. And much of it dates to the time of Pasteur, really not all that long ago. I told you a story about Semmelweis and the trouble he had trying to get doctors to wash their hands. Well, not long after Pasteur, they were able to give doctors a reason to wash their hands. All right? So Pasteur, and we'll see Robert Koch being two of the big heroes. Pasteur was a chemist. He was a doctoral student, so he was a student, wanted to get his doctorate in chemistry. And for his doctoral dissertation, what he was going to do is get crystals of potassium tartarate and put a polarized filter in there, and he was interested in the idea that crystals will rotate the axis of polarized light. He wanted to understand why potassium tartarate rotated the axis of polarized light. So a lot can be learned by looking at how light interacts with crystals. And so in chemistry, that was so basically he's a chemist. But he got into it this way. He wanted to go buy crystals of potassium tartarate. He went to the winemakers who, in the making of wine, they produced potassium tartarate. And they would sell it to people to make tartar sauce and for other purposes. And he wanted to get large crystals, so he went to the winemakers. He went to the winemakers and told them, I'm a chemist and I want to buy your big crystals of potassium tartarate that you discover in your winemaking. They said, fine, you're a chemist. Just the guy we want. You can help us with a problem we've got. He says, what's your problem? They said, well, sometimes the wine goes bad. And we figured that as a chemist, you could tell us something has happened that makes them. He says, what do you mean the wine goes bad? He says, well, sometimes the wine tastes like vinegar. And sometimes it tastes like burnt rope. Sometimes we can produce a good wine, but then sometimes the wine, we get a bad, maybe it's some bad chemical reaction or some ingredient or something in there. So Pasteur says, okay, what is the chemistry of wine? How do you produce it? And they said, we just follow the recipe. We don't know the chemistry. So Pasteur says, well, what's the recipe? He says, well, they said, we grow the grapes, we pick them, you squish them. A bunch of people jump in the vat, squish them, put them in a press, squish them even more, squeeze out all the juice, put the juice in a vat, it starts to bubble. We figure it's some kind of chemical reaction going on. Bloop, 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 gas comes off. Pretty soon it goes from sweet grape juice to alcoholic wine. Makes you intoxicated. So Pasteur says, well, I don't know if I'll be able to help you because I don't know much about the chemistry of this, but I've got my microscope with me. I was planning to look at the crystals of potassium tartarate and use my polarized filters. I'll look at them under the microscope. When he looked under the microscope and he saw good wine, when he looked under the microscope he saw this kind of a picture. And then when it looked like burnt rope, he saw another kind of critter in there. And when he tasted like vinegar, he saw another kind of critter in there. And so he said, I can predict what the wine is going to taste like by looking at it. So he was a guy for drama, Pasteur. He said, I would set up a table on the town square, and people would bring me bottles of wine, and without tasting them, I will look at them through the microscope, and I will be able to predict what the wine is going to taste like. And so he was able to do that. People were impressed that he was able to look at the wine. If he saw this, he said, that's going to taste like wine. If he saw this, he said, that's going to taste like burnt rope. So this, that's going to taste like vinegar. And he jumped to the conclusion that these diseases of the wine, as he called them, were produced by different microorganisms, different germs. And he began becoming interested in these microorganisms. What are these? These are things you can't see normally, but they can be seen through a microscope. Can be seen in the wine. And then he got interested in a gold medal that was being offered for somebody who could settle the question of spontaneous generation. They said, we will offer a gold medal to anybody that can do an experiment and resolve the question of spontaneous generation. You know what the problem of spontaneous generation is? That's this question. Can you create life chemically? Or does life have to come from life? Is there something special that makes something be alive? Or is it just a chemical reaction? Right? Does life come into being easily, or is it tricky to create life? So the question of spontaneous generation, people used to publish recipes for spontaneously creating mice. What you do is you get a cardboard box, and some old t-shirts, you rip up the old t-shirts, put some newspapers and t-shirts, get a box of rice checks, dump the box of rice checks into the box, put it in your garage and leave it there 3 or 4 months, you're going to get mice. Right? It's a chemical formula for mice. Right? This works. Try it. It's a good way to get mice. Maybe rats. So maybe people thought, all right, the mice, that's silly, but these microorganisms, are they simply coming into being on their own? Or are these microorganisms come from other microorganisms? Now Pasteur looked and he found that somebody earlier, Spallanzani, an Italian scientist, had done these experiments, and Pasteur repeated these experiments, submitted them for the gold medal, and won the gold medal on the question of spontaneous generation. So it helps to be able to read the literature. Some people rediscover things and are able to get credit for them. But Pasteur gave credit to Spallanzani, but he got the gold medal anyway. If you take chicken soup and you leave it out, the chicken soup starts off nice and clear. But if you leave it out for a while, all of a sudden you notice that it gets kind of almost like a skin on the surface, and then pretty soon it turns cloudy. And if you look at it under the microscope, you see these and these and these. and a whole bunch of other things swimming around in there. Did these organisms come into being simply because the ingredients for life were included in the chicken soup, or did they get in there from other organisms? So Spallanzani heats up the soup and seals it in a flask. So he's got a bottle basically, and he melts it shut, and he discovers that the soup stays clear, and under the microscope no microorganisms. And he realized that maybe air is a necessary ingredient, part of the chemistry. So he said, what I will do is I will boil the chicken soup and have a flask with a neck that's complicated, seal it up, and then break it off so that air can get in. So the air can get in there, but particles of dust are going to end up collecting here and not get in there. So the air could get in, and the chicken soup stays good in this situation. So even though air is available, organisms don't spontaneously come into being. So the rule is to preserve it, heat it up, and seal the flask. And so Pasteur said, I have advice for you winemakers. And they said, if you've got advice for us, we'll name it after you. So they named it after him, and what did they call it?
Pasteurization.
Pasteurization. Heat up the wine and stick a cork in it. That's the advice. So that's why your wines come with a cork on the top. They heat it up to 120 degrees Fahrenheit. Not hot enough to boil, but hot enough to kill the microorganisms that are converting the alcohol. These guys are mycodermia. They're converting the alcohol that's in the wine is being converted into vinegar. Now these nice organisms, these guys, these are the yeasts. They're the ones actually doing the work for the winemaker. They digest the sugar and they urinate out the alcohol. And then the mycodermia will eat the alcohol, so they'll consume the alcohol, and what they urinate out is the vinegar. So if you're in the vinegar making business, that's okay. You like you need the mycodermia to create the vinegar for you. But if you're in the wine making business, you don't want it to taste like vinegar. So these diseases of wine were caused, each disease was caused by a different organism. And Pasteur went to work on other organisms and eventually worked on things like rabies, the silkworm bacteria that were killing silkworm in the French silkworm industry, chicken virus, chicken cholera, all sorts of other diseases. And a contemporary of Pasteur, so that's basically, so the process, you're most famous probably at your age for drinking pasteurized milk, right? Heat up the milk to kill the tuberculosis or the other disease, listeria, the other diseases that can kill you that are in cow's milk. You kill those bacteria by heating it up and then seal it in the bottle. And it's safe now to transport the milk, and a lot less disease is happening thanks to pasteurization. Every once in a while they screw up, like the Jalisco cheese factory in Mexico. The Jalisco cheese factory, there was a valve that had the pasteurizer and then tubes carrying it over into the cheese production, and the tube was left open, a valve was left open, unpasteurized milk was mixing with the pasteurized milk and being entered into the eventual cheese process. So the Jalisco cheese was killing people with listeria on both sides of the border. It killed, I don't know, about 150 people in Mexico and about 19 people in the US from that. They traced it to a valve being left open. Unpasteurized milk was being allowed to go into the cheese making process. That happened about 10 years ago. But since pasteurization came in and is being, when it's followed correctly, it saves lots of lives. And you're all familiar, you'll read your milk bottle, mostly you're using pasteurized milk. Now, what's the criticism here? Criticism of Pasteur's work is he's got this chicken soup that's got a lot of different organisms in there, and he's using correlation. So he's able to predict, but is this really causation? And so a German bacteriologist named Robert Koch says, I would like to establish clear-cut criteria for showing that a particular germ causes a particular disease, because then we will know what causes disease. We want to be able to show that a particular germ. Now, Robert Koch should not be confused with the Koch brothers. So in the United States, this guy is a contemporary of Louis Pasteur in the 1860s and 1880s, 1860s to the 1880s, in that period of time. The Koch brothers are still alive. They're old guys, but they weren't alive at the time of Pasteur. That's well before their time. Koch brothers are in the news all the time because they're famous financiers of right-wing causes. The father was in the oil business. He claimed to have a new way of refining oil. The American oil companies sued him. He said, fine, I will take my methods for refining oil to the Soviet Union. He went to work for Stalin. He became fantastically rich thanks to the communists who refused to pay royalties to American companies for their oil refining equipment that he brought over from the United States to Russia. He came back to the United States after Stalin died and was criticized. He wrote a book against Stalin saying how horrible communism was and how terrible Stalin was. And then he taught that to his sons, who become the four Koch brothers, two of whom are the ones that are famous for financing right-wing causes. They're planning to spend $800 million on the next presidential election. They spent $250 million. They're the guys, remember the government was shut down a year and a half or so ago? They spent $250 million on that. $250 million in, I will call them bribes, donations to political candidates. Our local congressman here, Royce, took $2 million from them. So they gave him a donation of $2 million. Just for way of contrast, Ed Royce was able to raise $60,000 from people in Fullerton who want to contribute to his congressional campaign, but he took $2 million from these guys in Texas that inherited all this money. So do not confuse Robert Koch with the Koch brothers. So if you want to understand American politics, basically they're one of the reasons to understand why the Republican Party has gone so far to the right, many of the candidates, is because they're being financed by the Koch brothers, who have their own extreme ideas based on their father's odd ideas, based on his experiences in the Soviet Union working with Stalin. All right. So Robert Koch had the following idea. He says, instead of growing bacteria in a liquid, grow it on a solid medium. So you've got Pasteur's chicken soup with a lot of different organisms in there. You take a hot wire, or you take a wire, heat it up in a Bunsen burner till it glows. Presumably we've killed all the microorganisms. We let it cool, we dip it into Pasteur's chicken soup. Lots of organisms in there, and we wipe it across the solid medium. Today we're going to use a Petri dish with a flat dish that has a solid growth medium like Jell-O, something solid. And you take your wire and you wipe it across there, spreading out the germs. And what you discover is that colonies grow that look different. Each one, theoretically, having been started by a single germ. And then we say, this is the one we're interested in. We look at these under the microscope, we decide this is the one we want to grow. So now we go to another Petri dish. This has been boiled and it's clean. We heat up our wire, we dip into this one, just into this colony, and we spread it out. And now we get a bunch of colonies that look just like that one. Maybe there's a different one over here growing too. So we've got to dip in and do it again until we get a pure culture. And what's meant by a pure culture is eventually you're going to have a Petri dish that when you look in there and look at it under the microscope, there's only one kind of germ growing there, not a whole zoo of different microorganisms. A single organism you've got growing, so that now the colonies all look the same, and microscopically you don't see any other kind of creatures growing in there. You get a pure culture. And now here's how you show. You get an animal with a certain disease. Or a human, so humans are another kind of animal. So we've got a woman who died of childbed fever, or a person with tuberculosis, or a cow with tuberculosis. And we extract the germ from the diseased animal that we suspect might be the cause of the disease. And we get a pure culture. So that we only have one kind of germ. So we've identified, this is Pasteur's part, he shows that the different wines that had different diseases had different germs in them, but now we get a pure culture, and now we take a healthy animal, and we inject the germ into the healthy animal and show that we can make it sick. This is something that had previously been done, not exactly because he didn't have a pure culture, but remember Semmelweis took pus from a woman who died of childbed fever and was able to sicken rabbits and make them sick and have them die. So he could kill rabbits with material from a woman who died of childbed fever. Koch's introduction here is to have it be a pure culture, show that we now know it's just this single germ that we're injecting into the previously healthy animal. We're causing the same disease. The disease should match. Show that we can extract the same germ. And check that it matches microscopically. Show that under the microscope it matches. And then repeat the process so that you can transmit the disease from one animal to another, causing the disease as you go, getting a pure culture each time, a single germ, introduce it into an animal, cause the disease, extract it, get a pure culture again, show that it's the same germ, introduce it into another animal. Then you can say, this germ causes this disease. Now, what can you do if you have that theory? This is called the germ theory of disease. So here, now it becomes a real scientific theory. This is the biggest idea in medicine in the history of medicine. Probably 95% of all the benefits of modern medicine have come from this one idea right here. What can you do if you know this? Well, first thing you know is, how does the germ get from one person to another? Is it spread by sneezing? Is it spread because it can lay on the ground and then be picked up? Is it spread through food? Is it spread through the water? Does a bug get it from the blood of one person and then, like a mosquito, inject it into another person? And the answer is yes. Different diseases are spread different ways. Malaria is spread by a particular type of mosquito, sucking it up in the blood from one person and injecting it into the blood of another, or from an animal that's carrying a disease. Also, other diseases, Lyme's disease is spread that way by ticks that are biting diseased deer and then biting a person. Other diseases are spread in the same way. The tsetse fly is spreading encephalitis. Sleeping sickness is being spread the same way. The St. Louis encephalitis is spread by mosquitoes in this country. West Nile virus is spread by mosquitoes in this country, including in Fullerton. We always have a few. If you see dead birds over in the Arboretum, might not be a good day to visit the Arboretum. It means there are mosquitoes at work maybe carrying that West Nile virus. All right. So some germs are spread by insects, and if that's the case, what do? You try to kill the insects. So you go out and spray, you get rid of where there's pools of water. You got pools of water around your house, spill them out so the mosquitoes need to breed in the water, or put chemicals on the water to poison the mosquitoes. Put up tents around people that are sick so the mosquitoes won't bite them and then bite other people. If it's spread in the water, cholera is spread in the water, You can prevent the disease by boiling the water. Don't drink water that hasn't been boiled. In the case of HIV, how is it spread? It's spread through close bodily contact with liquids like blood and semen, maybe mother's milk. So it's spread by contact with bodily fluids, as is Ebola, spread by contact with the body fluids. Two fairly deadly diseases. Ebola being a little more catching. You have to get a little bit closer contact to get HIV from somebody. For both of those diseases that can kill people. So once you know how it's transmitted, you know how to prevent the disease. You can prevent it. So once you know what causes it, the germ theory is that a particular germ causes a particular disease. Do you know how to diagnose it reliably? Yes, you can. You identify that if a person is carrying this particular germ, they have this particular disease. And you're not really sure what disease they have till you know what the germ is. So if a person looks red and has a fever, in the old days you call it scarlet fever. But it turns out there's more than one germ that can produce that. So you want to figure out what germ do they have. If it's the strep germ, penicillin, we've just learned, would work against it. Penicillin might be the treatment for scarlet fever if you know it's produced by strep. But there's a certain staph and there's some other bacteria that can produce very similar symptoms that are hard to, just from the clinical appearance, the fever, the sore throat, the redness in the throat, the rash. These symptoms can appear with several other bacteria that can produce it. But we can diagnose it reliably. And when we have, in the case of antibiotics, these were invented to kill the bacteria. Things that kill the bacteria could cure the disease. So there are medicines that will kill in the case of some of these bacterial diseases. Now in the case of HIV, we know that bleach will kill it. So you can prevent it. I mean, in the case of people that are injecting themselves with drugs and sharing needles, if they will clean their needles between people, they won't spread it from one person to another, but it's being spread among drug users by sharing needles all the time. So unfortunately, people that use these needles oftentimes are in the prostitution business, so they're spreading it, then they get it, they pick it up through the use of these sharing needles and give it sexually to other people who go home and give it to their wife, goes home and gives it to her boyfriend. These diseases spread this way. If you have the germ theory of disease, there's also vaccination for certain diseases. So the human immune system can be primed to deal with disease. And so vaccination can be used to prevent the disease. Smallpox actually was wiped out, and measles almost was wiped out, but it's come back thanks to people who don't want to be vaccinated. We talked about that already. So the germ theory of disease, this is really the benefit of modern medicine. Modern medicine without the germ theory of disease would be like 5% of what it is right now. This one idea is the center of going from bleeding people and hoping that that'll make them better, to being able to prevent disease and cure it, and really prevent it. Sewer systems, pasteurization, vaccination, antibiotics, all come about because of the germ theory of disease, understanding what causes it. Now, do we have this in the case of mental illness? Wait just a minute, we still have like another minute to go. Do we have this in the case of mental illness? No, what we have is scarlet fever. So let me ask you, what is schizophrenia? It's a collection of symptoms. What is paranoia? It's a collection of symptoms. What is anxiety disorder? A collection of symptoms. And we're going to go over those collections of symptoms and the descriptions that we have, but one of the things you got to realize is this is like old medicine. This is like medicine before the germ theory of disease. This is medicine where you don't understand the causes and where what you're doing is simply cataloging the symptoms. All right? And we're going to go through that catalog. It's called the DSM, the Diagnostic and Statistics Manual of the American Psychiatric Association. All right.